Good evening, everybody, and welcome to everybody. I wanted to kind of give you a bit of an update as to what has been going on in the field of educating healthcare professionals in Northern Ireland and raising awareness about ME. And you often hear the charity talking about we're doing a lot of work, a lot of project work, etc. But what have we done, and what has been the effect, the result of it? I think many of you might want to know. We certainly had broken the realms of medical education, and we've got long established links with the School of Medicine in Queen's, but we hadn't really bridged and broached some of the other healthcare professional barriers, and I'm ashamed to say one of them was nursing, being a nurse. So we managed to set up a meeting with Queen's University head of nurse education in the School of Nursing at the beginning of last year. And what came out of that then really was all of this. So we organised teaching education for undergraduate student nurses, two separate, what do we call them? Two separate episodes of education. And the fact that these are undergraduate nursing students means that they're not registered. So we're getting them at a really, really early stage of their training. They were second year student nurses. So it was online education, and the reason for that was because it was such a huge number of nurses. So the first cohort was 200 nursing students, and the director of nurse education, she really delivered the educational piece and did quite a bit of coverage around the code of nursing. It maybe we wanted to have more input, but that was the way they wanted to do it at that time, and things have evolved from that. But the input we did have was, and she's not here tonight, was from our big gun star, Rebecca Logan, who is our long COVID representative within the charity. And she did a lived person's experience, which is hugely valuable. So the first online education teaching session was the 30th of April, 200 student nurses delivered by the School of Nursing Director of Education, Joanna McMullen. The second one was on the 16th of July to 70 student nurses, second year student nurses. We showed the charity's Discover ME film, which was really powerful, real life stories of 6 people living with ME in Northern Ireland. And then Rebecca Logan did her 20-minute patient lived experience piece, which was really powerful. As part of all of this, Queen's University PhD student Tara Anderson, who some of you might remember, she is a volunteer with the charity, and in 2023, she did a study for part of her MSc degree. And basically what she did was she used our Discover ME film, she showed it to groups of medical students and other healthcare professionals, and then she evaluated their response in terms of their learning, their education, and their empathy towards people with ME, and was able to statistically prove that by watching this film, their knowledge and their awareness significantly was raised. So she then now is actually working for the School of Nursing in Belfast in Queen's, and she and Joanna wanted to replicate the study within the School of Nursing. So she did what we call a pre and post test analysis on the student nurses, which showed increased knowledge of ME and empathy towards those living with the condition. So student feedback, this was just to give you a bit of a flavour of what the feedback was. 2 questions were asked. What did you like about the session? And a lot of them had spoken very highly about Rebecca and how much this had improved their knowledge, that she was very brilliant and brave and honest in what she had said, and it was very emotionally touching and informative, and that they felt that this was a really good way to get education at first-hand experience, very informative to getting to hear the personal experience. And then the second question was, how might this learning impact your future practice? And people were saying that they felt they would have more compassion and empathy and understanding and, interestingly, fight for advocacy of the patient. They felt the talk had greatly impacted their practice very positively moving forward. From the session, they felt they would have an awareness of ME and be more understanding and open-minded. And it made them more aware of what ME is and how it affects the patient and their abilities. And the last one I thought was quite important. It made them be more mindful of conditions that may not have definitive answers, which we're all only too aware of. And big important statement that the patient's symptoms are what they say they are, which oftentimes we know are not believed. So that was Queen's. Then we approached Ulster University, and again, were really very well welcomed. And what came out of that was then 2 educational sessions, but this time for postgraduate student nurses. So these are registered nurses qualified for a number of years, and there were 2 groups. There are 2 small groups, obviously, you see the numbers there. One was advanced nursing practice students, or ANPs, which was similar to the job I do. And then the second group was to general practice nursing students. The content was that it was face-to-face this time, so it wasn't online. I delivered a presentation on ME, which was quite intensive, I'm sure you can imagine, which was quite thorough. And then we showed the Discover ME video. And then we also showed the BBC interview between Sarah Boothby, the mother of Maeve Boothby O'Neill, and Dr. Benita Kane, who with the pleasure of company tonight. And that was a breakfast news interview that was done a few years ago, and extremely powerful. I mean, it's about 22 minutes long. It's available on YouTube for anybody to watch. But we felt that it delivered such all of the messages you wanted to deliver in terms of making people aware of how people are mistreated, disbelieved, of what's missing in terms of lack of services, of why people need to be better educated. All of that was captured very succinctly in that interview, and it was very powerful. So we showed that as well to the students. Then Rebecca did her lived patient experience. She zoomed in online, so that's how we were able to facilitate her being there on that day. And she stayed for the sort of questions and feedback at the end. So we had a bit of a discussion group and feedback session at the end, and these were the results of the feedback whenever I analysed their questionnaires. So in total, really, what they said was that the content delivered, they scored it as excellent by most students in relation to the knowledge that they gained. This was sort of a summary of all of the comments that were made. So the majority really had little to no knowledge prior to having this education about ME. They were keen to challenge and educate other healthcare professionals in the workplace about ME, which I thought, well, that's good if you do that. They will consider ME when assessing future patients with complex or long-term conditions. And remember, these are post-reg nurses that are specialising as being practice nurses and advanced nurse practitioners. Some of these will be diagnosing conditions and others will be providing long-term condition support. They said that they acknowledge the struggles people with ME face in being diagnosed and disbelieved. They'd gained an understanding of how debilitating ME can be, and that the lived patient experience was so valuable, interesting and memorable. And lastly, that the knowledge gained with regard to symptom recognition, person-centred care required. I mean, they recognised this and the importance of validating the patient's story. So I think in summary, you know, the feedback was really good. Certainly everybody felt it was worthwhile. The outcome of both the sessions, both at Queen's and UU, has been that the heads of education want us to repeat the sessions with the next cohorts of nurses. And in UU particularly, they would also like us to extend it maybe to some allied healthcare care professionals as well. So it's hopefully you can see by that it does make a difference. Yes, we would love to know now that as a result of all of that going forward into practice, that it actually makes a difference for the patients on the ground. But hopefully, we're trying to change minds of those that we're educating in nursing at the minute, and hopefully other healthcare professionals going forward. Okay, thank you.